Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today we are going to discuss about eye injuries or eye infections which basically develop because of plants, vegetation. Especially these are encountered by the people who are working in the fields, in agriculture sector, farmers. And even if they are not working in the fields, even daily people who do gardening or this plantation, they can develop this type of eye infection. Yes, I'm talking about the fungal eye infection. So let's have a discussion about this topic today. If we talk about the fungal eye infections, it was first time documented in 1879. Yes, and since that time, more than 100 species of fungus have been identified which infect and cause injury and infection in the human eyes. Yes, so they may exist in the form of yeasts, they may exist in the form of filamentous fungus, but usually what happens that when we are working, farmers are working in agriculture, or we are dealing with vegetation or gardening and these things, there we can, if something goes in eye, there are chances that with the breach of eye epithelium, as we discussed earlier, that bacterial infection goes, microorganisms which are usually present in the eyelids, they can go in the eye. So these are exogenous. These come with the vegetation, fruits, vegetables, crops. They can go over there, and the fungus, once the epithelium is damaged because of micro injury in the epithelium, they get their way to make an entry into the eye, and then they proliferate over there and can cause damage. So now we will see about the different types of fungus under the microscope. How do they look? This is called aspergillus, and this is mostly encountered in the agriculture sector. We find prevalence higher in the northern part of the India. This is quite prevalent. So this is one type which is called aspergillus. Called candida, round shaped structures under the microscope in the form of clusters and clumps. Usually they are prevalent and they are causing eye infections in UK. Talk about United States of America. The number one fungus which is infecting the eyes and damaging, that is fusarium, which is shown over there in the form of filaments, we can see, and beautifully shown in this slide. So these are different types of fungus. Every region, because of their climate, because of their atmosphere and humidity, they are different. So that's why briefly I told you about aspergillus, candida and fusarium. Talk about the fungus, as I mentioned earlier, we can say that these are somewhat opportunistic infections. Opportunistic in this sense that usually they are present over there in the fields, in agriculture, in vegetation, in plants. But whenever eye is damaged, even minor trauma because of things, this is possible over there, especially when the workers are doing their job in the fields. It is possible to get damage over there, even minor breach, and they usually rub their hands, or sometimes a vegetation goes into the eye over there, and no doubt there will be a corneal epithelium defect, no doubt. But once it has been damaged, this fungus can get entry into the eye, that's corneal epithelium, and once it goes over there, it starts proliferating, and it is quite challenging to manage the way it goes over there and proliferates, quite challenging. So I should say that it is some sort of opportunistic that waits over there. Usually if the corneal epithelium is intact over there, people work in the fields, nothing is going to happen. But unless and until some vegetation comes in contact with the eye over there and epithelium is breached over there, then they get their entry and then proliferate. And once they are there, they cause damage then it is very much possible that the bacteria over there, the microorganisms which are present already in the eyelids, they can also cause secondary bacterial infection. So that is also possible. Yes, these patients come to us in our clinic. We take a proper history, and a good physician always keeps in mind this element when he is dealing with corneal eye infection or ulcer. Their typical presentation is feathery like filaments over there. They may be satellite lesions. Satellite lesions, we say that one area is involved of the cornea, then second, third, fourth, they are satellite over there. And sometimes they may be in a plaque shape over there, so which gives an appearance just like bacterial infection. So these are different types of representations, but usually feathery they may be over there, and satellite lesions, different points are involved over there. So in this slide which has been shown, the patient has developed corneal ulcer infection because of fungus, beautifully shown in this slide. And as I always say, that cornea is avascular, it has no blood supply. There is no blood vessels, and because of no blood vessels, it is transparent, and when it is transparent, it conducts light. But it has some disadvantages because of this no blood supply. That is, it has got weak defense mechanism. Its immunity is weak because there is no blood supply. If there is blood supply, it will not be transparent. So it is always transparent because of avascularity. But on the other hand, it becomes weak. So these microorganisms, now I'm talking about the fungus, they get a chance to proliferate over there and then go over there in the eye. They can slough off, they can damage it, and even they can make pus in anterior chamber. So this is possible over there. So particularly this fungal infections I'm talking about is because of the vegetations, plants, agriculture sector, workers working in the fields, they can have. And as I always mentioned, the treatment should not be blind. We should always do scraping first. And apart from other blood cultures, for the fungus growth is separate, which is shown here in this slide. The sample is taken, it is put over there and sent to the laboratory immediately. For the culture and sensitivity, it takes some time to grow over there, and then the pathologist will give us the exact report which type of fungus is over there and which antifungal medicine will help us to control this organism. So this is very important. And apart from this, once we have sent the culture over there to the laboratory, we can start our own antibiotics as per our physical and clinical judgment. We can start it. This is basic, which is done. If it is so advanced technology and techniques and you are working in a tertiary hospital, then polymerase chain reaction can also be done, but it has relatively low specificity. So this is the one slide I have shown you, that how it has damage over there. This is the beginning of the phase, how it develops over there and it grows. We talk about fungal treatment. There are a number of medicines which can be used, and in these situations usually there is TST therapy, that is topical, systemic and targeted therapy. Natamycin eye drops are available. They can be used to control the infection. Along with this, if it is more than 5 millimeter corneal ulcer and more than 90% of the depth of the cornea has been involved, then we can go for systemic also. Yes, voriconazole and ketoconazole, these are the medicines, antifungal, which can be used in close consultation with the infectious control department. Yes. And then if things are not getting better, even topical voriconazole, they can be used. So there are multiple medicines which can be used to control this infection according to culture and sensitivity report. That's very important. But let me tell you, this is different from bacterial infection. It is very challenging, tricky, and it takes time to get controlled. Yes, it takes some time to get over there come under control. So, but in spite of sometimes, in spite of our full treatment, the infection is so much, as shown in this slide, that we have to go to save the eyeball. And infection is not getting controlled, and there is pus in anterior chamber, and there are high chances that if we do not do some surgical maneuver at this stage, it can penetrate inside the eye. So this is some advanced stage of a fungal infection which has been shown in this slide. If we are treating the patient and 4 weeks have passed by and still infection is not getting controlled, so this is a situation, just we have to go and remove the cornea. Yes, we have to remove, we have to go for therapeutic keratoplasty, we have to remove that infected chunk over there whole and put a new cornea over there, so that all sorts of infection and everything is taken over there out. And even then we have to continue for a while the topical antifungal medication and oral medication. We have to continue for a while until the things come under control. Yes, so this is quite challenging, but this is not what when I say that this is farmers or vegetations and plants dealing over, they can have the fungal infections. Yes, they are prone, but many times you will see a patient who has got kidney failures, renal failure, immunity is very much low, he's on dialysis, he has diabetic foot is also infected over there, so low immunity. So these patients can also develop fungal eye infections. They are also prone to this. And even sometimes contact lenses can also, you can have these infections. So all these things, but particularly when I'm talking about this, it usually comes from the vegetations, plants over there. So, dear audience, this was my topic of discussion for today, in which we briefly discussed different types of fungus, and when physicians are dealing, they should keep in the back of their mind that if in the history, or if there is an injury from the plants or vegetation, the patient can develop this type of infection, and culture and sensitivity and laboratories workup and pathology reports are very helpful to reach our diagnosis and proper treatment. Because many times it happens that if a physician does not concentrate on the history and he keeps on treating blindly with antibiotic drops and does not go for scrapping, and then later on when the infection spreads, then they think about this scrapping. Sometimes they come to know, oh, this is fungal infection and this thing has been missed. So this should always be in the back of the mind of the physician when he's taking and discussing with the patient about the mode of injury, mode of trauma, and since when it is present and what treatment has been given earlier. I hope my today's presentation will be beneficial for my respected audience. I want to thank you for your attendance and attention. Thank you.